Hey there, health enthusiasts and curious minds. Have you ever heard of Morgellons disease? It's a condition that's puzzled doctors and patients alike for years. Today, we're diving deep into this mysterious illness. We'll explore what it is, what might cause it, and how it affects people's lives. So grab a cup of tea and get comfortable. We're about to unravel the enigma of Morgellons disease. Let's start with the basics. What exactly is Morgellons disease? Morgellons first caught public attention in the early 2000s. People reported strange symptoms like crawling sensations on their skin. They also noticed fibers or threads coming out of sores on their body. Imagine feeling like bugs are crawling on you all the time. That's what many Morgellons patients experience daily. But here's where things get tricky. The medical community is split on what Morgellons really is. Some doctors think it's a physical illness. Others believe it's a mental health condition. This disagreement has made it hard for patients to get proper care. So, what might cause Morgellons disease? Let's look at some theories. First up, delusional parasitosis. Some health professionals think Morgellons is a type of delusion. They believe patients imagine parasites infesting their skin. In this view, the fibers patients see are just everyday materials. Things like clothing fibers or skin cells might be mistaken for something else. But not everyone agrees with this theory. Some researchers think infections might play a role. They've looked into bacteria like the one that causes Lyme-disease. However, studies haven't found a clear link yet. Environmental factors are another possibility. Some people wonder if toxins or pollutants might trigger Morgellons. These substances could irritate the skin or mess with the immune system. But again, we don't have solid proof of this yet. Genetics and immune system issues are also on the table. Some scientists think certain people might be more likely to get Morgellons. Maybe their genes or immune systems make them more vulnerable, but we haven't found any specific genetic markers for Morgellons. Now let's talk about spotting Morgellons early. This is tough because there's no standard test for it, but there are some signs to watch out for. First, pay attention to any weird skin sensations. Itching, crawling, or biting feelings that won't go away are red flags. Also, look out for sores or rashes that don't heal normally. If you see fibers or threads coming out of your skin, that's another sign. Some people with Morgellons also feel very tired or have trouble thinking clearly. If you notice these symptoms, it's important to see a doctor. Don't try to diagnose yourself. A healthcare professional can help figure out what's really going on. Now, you might be wondering, can we prevent Morgellons? While we can't prevent it for sure, there are some things that might help. Keeping your skin clean and healthy is a good start. This can help prevent infections that might make skin problems worse. Managing stress is also important. Stress can make you more aware of physical sensations. Try things like meditation or therapy to keep stress in check. It's also a good idea to avoid harsh chemicals on your skin. These could irritate your skin and make symptoms worse. Let's hear from some health professionals about Morgellons. Dr. Ann Jackson, a dermatologist, says,
"It's essential to rule out other dermatological conditions before considering a diagnosis of Morgellons. In many cases, we find that the symptoms can be attributed to more common skin disorders."
Dr. Robert Myers, a psychiatrist, adds that
we must consider the psychological impact of the symptoms and explore whether underlying mental health conditions may be contributing to the patient's experience. Even if Morgellons has a biological basis, addressing the mental health aspects is critical for overall well-being.
Nurse practitioner Lisa Harper takes a patient-centered approach, saying,
regardless of the cause, patients deserve to be heard and treated with respect. A combination of medical, psychological, and supportive care can help manage the symptoms and improve the patient's quality of life.
So where does this leave us? Morgellons is still a mystery in many ways. We don't know exactly what causes it or how to cure it. But that doesn't mean there's no hope. If you think you might have Morgellons, don't suffer in silence. Talk to a doctor who will listen to your concerns. Remember, your symptoms are real, even if we don't fully understand them yet. There are ways to manage the symptoms and improve your quality of life. The medical community is still working to understand Morgellons better. As we learn more, treatments will likely improve. For now, the best approach is a team effort. This means working with different types of healthcare providers. Together, they can help address all aspects of your health. That's our deep dive into Morgellons disease. We've covered what it is, possible causes, and how to spot it early. We've also heard from health professionals about how to approach this condition. Remember, if you're dealing with unexplained health issues, you're not alone. There are people out there ready to help and support you. If you found this video helpful, please give it a like and share it with others. Do you have experience with Morgellons or similar conditions? Share your thoughts in the comments below. Thanks for watching, and take care of yourselves out there.